Welcome back. On today's edition of the program, I will be having as guest Dr. Obam Mayo Jean Daril, a medical practitioner at the Bingo Baptist Hospital. It is a pleasure having you on the program.
Good afternoon, Immaculate.
Good afternoon.
The pleasure is equally mine.
Okay, so today we'll be looking at the prevalence of diabetes in Cameroon. First of all, what does it mean to be diabetic?
Okay. We can look at diabetes as basically for the general population to understand as a group of disorders that is characterized by a continuous elevation in the blood sugar, and this is usually a result of either a defect in the hormone called insulin. So it's either a defect in the action, in a decrease in the quantity, or the absence. Either you have an absence of insulin, the complete absence of insulin, you have the reduced response, or you have other counteracting hormone that are having a more increased effect.
So now, what are some of the signs and symptoms? Can I just look at someone and just say that person is diabetic?
Okay, so it is important to understand that diabetes can be asymptomatic, but some of the classic signs and symptoms, I would like the people to understand something about a rule of 3P. So this is polyuria, which is increased excessive urination. Polydipsia, that's basically excessive thirst. You have polyphagia, that's excessive hunger. So in addition to that, we have fatigue, we have weight loss. So now, depending on the stage of diabetes, you can equally have some other complications. For instance, nerve involvement of diabetes, which is sometimes you feel some paresthesia. We have some people complaining of muscle cramps, which should not be attributed to calcium, that is usually done in the quarter. So they need to also consider that it can be related with the diabetic neuropathy, which is one of the symptoms as well.
And who is at risk of suffering with diabetes?
So we would like to say that everybody is at risk of diabetes. We can have diabetes at any age, even from childhood. So, but there are some factors that increase the likelihood of getting diabetes. For instance, if it concerns mostly type 2 diabetes, which is the most common type of diabetes, the likelihood is increased with people who are age greater than 45 years, some people who are overweight, people with a family history of diabetes, people with physical inactivity with a high tendency of sedentary lifestyle. That's basically what we can have.
That's for type 2 diabetes?
That's mostly for type 2 diabetes.
So now, if we want to talk about type 1, is there a difference between type 1 and type 2 diabetes? Okay,
basically in type 1 diabetes mellitus, we have an absolute insulin deficiency, if we can put it basically that way. So what happens in type 1 diabetes is usually an autoimmune disorder, and the autoimmune disorder is secondary to the destruction of cells that are in charge of producing the hormones that they call insulin, which is actually very important in carrying the blood sugar that is in the bloodstream and send it back into the cell for the cells to use it as energy. So that's basically as far as that's concerning type 1 diabetes. Now, when it comes to type 2 diabetes, you have either a decrease in the action, decrease in sensitivity. So the insulin that is being produced is not able to act adequately. So cells are not responding adequately, and consequently, it causes the blood sugar to remain in the bloodstream.
Okay, now let's focus on a child. You said anybody is susceptible of suffering with diabetes. When it comes to a child, what can be the main cause of a child to suffer with diabetes?
Okay, children with diabetes, in the majority of time, children with diabetes have type 1 diabetes mellitus. So children can have autoimmune disorders. So the autoimmune disorders now will lead to the destruction of the cells that are in charge of producing the insulin, which is responsible of removing blood glucose from the bloodstream to enter the cell. So basically, that's what happened in children. Okay, which is different from what happened in adults.
So okay, now we're still with the case of a child, meaning you say it's more related to type 1 diabetes.
Yes.
So now in such a case, is it that you have to give more sugar to the child, or you have to decrease the sugar intake of that child?
Okay. Actually, because in type 1 diabetes mellitus, the majority of cells, beta cells, actually, if you can call them, that's their scientific names, they are destroyed. So in type 1 diabetes, there is an absolute need of insulin. So you have to replace what is not there. In type 2 diabetes, there is a level of insulin. So actually you can compensate with some other medications. But for type 1 diabetes,
you have to give more sugar.
You have to give more insulin. You have to actually, it's like you because it is not, the insulin is absent, so you need to actually give the insulin itself to the person to be able to work.
So now what exactly is insulin?
Okay, so you know, the majority of people get energy from what they eat. And what they eat, inside what they eat is mostly glucose that we're looking for to get the energy.
Yeah.
So there's a hormone that they call insulin, which is being produced by an organ in the body that they call the pancreas. Mostly the islets of Langerhans in the scientific language. That's how they call them. So those cells are in charge of producing that hormones that is called insulin, and is the most important hormones when it comes to reducing the blood sugar in the body. So that's what insulin can be seen as.
Okay. To participate in the program, you can call us through the following numbers: 655-511111. I repeat, 655-511111 or 652-025050. Back to you, Dr. Daryl. Now, what's the normal level of blood sugar?
Okay, there are many reports. There are many reports about the value of blood sugar, normal value of blood sugar. Some will consider it as a value from 0.8 gram per deciliter to 1.2 averagely, but globally, if we want to take it averagely, it should be less than 10 I would say 10 gram per deciliter. So averagely, that's the value.
Now let's look at the diet of a diabetic patient. Should they just eat like anybody who is not suffering with diabetes, or there's a particular diet of a diabetic patient?
So it's important to know that when it comes to the lifestyle and the diet of diabetic patients, we are not only fighting against the sugar. Yes, we need to reduce the amount of sugar that we are taking. Okay. Yeah. But there are also other issues, because it's not only about the sugar, but many of the other basic elements like protein, like lipids. We need to also reduce the quantity of all of them. It's not only about the sugar.
We have a call on the line. We'll get back to that question. Hello, good afternoon. Your name and where you're calling from, and finally your question.
Hello.
Yes, sir. Good afternoon.
Good afternoon.
Yes, your name. Can you turn off your receiver? Can you please turn off either your TV or your radio set? Okay, we just lost that caller. Please, before you call for the program, make sure your TV or your radio set is turned off, because if it's not off, we can't get you clearly and it's going to obstruct our communication. Back to you, Dr. Daru. We're talking about dieting when it comes to diabetic patients.
Okay.
And you already talked about lipids, proteins, which have to be reduced. What more has to be reduced?
So, one of the most important aspects is the reduction of sugar, as we were saying. But there are also other aspects that you need to take into consideration. Even the quantity of food that we eat, we need to reduce the quantity. We should eat like small amounts of foods on a regular basis. When we say a healthy diet is planned morning, afternoon, and evening, and we should mix our diet with fruit, vegetables, and some quantities of meat, but we should not take excess.
Talking about fruits have sugar, right?
Yes.
Why is fruit better than the normal sugar we know when we know it has sugar?
Okay, when we say we should not take excess, we talk about excess in everything, being sugar or fruit. All of them can bring a lot of sugar, but we are talking about from a point of view of a non-diabetic.
Yes.
Understand? So reduce the quantity in all the aspects of the lifestyle. But when it comes to diabetic patient itself, you need to actually really reduce.
We have another call on the line. We're coming back to that. Hello? Hello, good afternoon.
Yeah, good afternoon.
Yes, so your name,
Afternoon.
where you're calling from, and your question. Please, can you turn up
I'm
your...
from Douala.
Okay, your question then. Hello, sir.
My name is, I wanted to greet
Oh, we just lost that caller. Please endeavor to turn off your receivers whenever you're calling. When your receiver is on, we can't really get you clearly. Make sure your radio or TV sets are turned off before you can ask your question. We know you love to get your question, but you can get that after the program. So we're talking about dieting, and we're focusing on sugar when it comes to normal sugar and the sugar gotten from fruits.
Okay, so as we were saying, in a diabetic patient is different.
Yeah.
So in a non-diabetic patient, we're trying to avoid that lifestyle that bring that increase the likelihood of getting diabetes. But for diabetic patients, it's different. The diet is very strict. Small amount of food, but regularly at the frequent hours. Reduce the amount of sugar. But we have not said no sugar at all, like 100%, because we know at a certain age, it's difficult to prevent yourself from.
We have another call. I hope it's going to be better. Hello, good afternoon. Hello. Oh Lord. We have another caller. Hello. The network is really poor. But try insist calling. We are going to answer some of your questions on diabetes. Now, let's now look at some of the risk factors of developing type 2 diabetes. What are some of those risk factors?
So, I talked a little bit about it, Immaculate, but to be more precise, there are a couple of things that makes the likelihood of diabetes to increase. So, for instance, people age more than 45 years. People who are overweight, obese patients with an increased body mass index.
Talking about obesity, how can you tell someone is obese? How is it measured?
Okay, to tell that somebody is obese, you need to know the weight of the person. You need to know the height. So it is measured with a formula. You take the kilogram, the weight of the patients per meter square, and then you have the body mass index. Okay. So usually a normal individual should be less than 25 kilogram per meter square. Okay. And then you should also be on too low, because it's also a problem to be undernourished.
Okay. So now, what are the common problems that come with suffering with diabetes?
Diabetes has a lot of complications. There are many. There are complications that are related to the diabetes itself, and there are complications that are even related to its treatment. But when it comes to the complication of diabetes itself, we have the short term, that is the complications that the people can have immediately.
We have another call on the line, sorry. Hello?
Hello?
Good afternoon, sir.
Good afternoon.
Your name, where you're calling from, and your question.
I'm François. I'm calling right from Baminda.
Okay. Oh my God. We have another caller. Hello? We just lost that caller. I don't know what's really wrong with the connection today. So we're talking about, can you help remind me? The common problems that come with having diabetes.
Okay, we're saying that when it comes to diabetes, we have complication of diabetes itself. So among the complications related to diabetes itself, we have short-term complications that you can have immediately, and long-term complication, that is if the patient remain undiagnosed for a very long time.
Exactly.
So immediately you can have a what they call hyposmolar non-ketotic state, where the patient will usually present in state of a coma or a lot of signs of excessive glucose. You have non-ketotic, that one usually occur in younger patients with type 1 diabetes, but it can also occur in type 2 diabetes. You have other complications. You have macrovascular complications, because you should know that diabetes mellitus increase the risk of cardiovascular diseases. So you can have cardiovascular diseases that affect the brain, such as stroke. You see a lot of people with ischemic stroke and all the line. You see the patient with cardiovascular disease themselves, such as ischemic heart diseases. They are also at risk. One of the organs that the diabetes also affect is the kidney. So you can have kidney failure. You can have diabetic nephropathy with the progressive damage of the kidney. So talking about long term, it involves there's an involvement of the small vessels, like they call it microvascular complication of diabetes. So we have, for instance, the involvement of the eye, diabetes retinopathy. That's why some people will present with blurred vision or maybe blindness. That is already an advanced stage of diabetic retinopathy. That is the ophthalmologic involvement of diabetes, the ophthalmologic complication of diabetes. You have also people with diabetic foot. I don't know if the people listening to us usually go to the hospital. You'll see somebody with a foot that is almost dead, that is black and is really difficult. It's really bad. So sometimes diabetes leads to complication like that. Sometimes you have the diabetic foot, and that might even need to be amputated. So somebody can lose a leg because of diabetes.
And why is it that when a diabetic patient has a wound on the leg, it takes long to heal compared to someone who's not diabetic? What makes that? What causes such a situation?
So sugar is a source of nourishment for the bacteria.
Okay.
When you have a wound, bacteria will try to come and feed on the wound.
Okay.
And then also, apart from that, when the body is trying to respond to the wound, to the injury, if you can put it like that, the body will send a lot of blood to send, how can I put it? To send cells to fight against the bacteria that are trying to come in. And then that blood itself contains a lot of sugar. So you can understand the mechanism. You send cells to fight, but they carry blood that is already having a higher level of sugar, which actually contains food for the bacteria who are there. So we enter a vicious cycle where bacteria keeps on increasing and the sugar keeps on coming.
I see.
That's why it's very difficult. And also, when it comes to vascular complications, you can have the narrowing in the supply of blood, because some people with diabetes have atherosclerosis. You have lipids, that is the bad cholesterol, accumulating around the blood vessels, and it causes the amount of supply to reduce. So you see that predisposes the peripheral area to start dying progressively. Imagine if you are not receiving enough blood, you start dying. The area does not have enough supply.
And in such cases, how do you handle them?
So it depends. It depends on the stage. So concerning the wound, is the question about the wound?
Concerning the wound, exactly.
Okay, concerning the wound, the very first thing is to control the diabetes. When you control the diabetes, you favor the wound healing. That's the first step.
I see.
People will take antibiotics in the quarter. They will see the wound is not improving. They will even go to traditional healers. They will go for prayers, not knowing that it starts from the control of the level of sugar, which is the control of their diabetes.
Talking about control, can it be controlled only with medicine? Or there's another, we have a caller on the line. Okay, can it be controlled only with medicine, or there are other ways of controlling diabetes?
When it comes to control diabetes, it usually involves many aspects. Diabetes is not only about medications, it's a holistic care. There's an aspect of education. People should know what is diabetes and what are the dangers of diabetes.
Yeah.
There are also aspects concerning lifestyle modification and dietary modifications. So it's not only about the medication, but it's a holistic approach.
What last advice do you have for diabetic patients watching you now?
So we would like to tell diabetic patients, our mothers, our fathers who are listening to us,
Exactly.
that diabetes is a chronic illness. It is not something that we have to take it for granted. We don't have to neglect it. It's something, it's a continuous fight. People with diabetes should not be discouraged. So at any moment you abandon your treatment, you allow the sugar to be high and you allow the sugar to destroy your bodies. It is cheaper to prevent complication of diabetes, but it's very expensive to take care of its complications.
It's cheaper to prevent complications of diabetes, but it's very expensive to prevent such complications. That was Dr. Mayo Jean Daril, a medical practitioner at the Bingo Baptist Hospital. Thank you so much for your keen attention. That's it for this edition of the program, UNA Health. For presentation, I am Immaculate Fogwe, and I received technical assistance from Rafael Dipanda. Stay blessed in the company of more programs on Equinoxe Radio and television. So long.
Comme chaque année, de nombreux enfants rêvent de vivre le réveillon de Noël. Célébration impatiemment attendue par des milliers d'enfants démunis et orphelins. Pour un Noël en cœur, Equinoxe Radio et Télévision tendent la main aux âmes de bonne volonté afin de soutenir l'édition de Noël en cœur 2021. Vos nombreux cadeaux sont attendus tous les jours jusqu'au 13 décembre au service commercial. Noël en cœur, un événement radio et télé Equinoxe.
If you suspect you may have a coronavirus infection, please call your healthcare provider in advance and let them know you are coming. This can help them be prepared. WHO recommends preventive measures to reduce your risk. Wash your hands frequently using soap and water or an alcohol-based hand rub. Avoid touching your eyes, nose, or mouth. Avoid eating raw meat and unnecessary contact with wild animals. Avoid close contact with anyone with flu-like symptoms.